Hi all, welcome to Learn Nursing with Anu. If you are a nursing student or an internationally educated nurse planning to work in countries like the USA, Canada, or Australia, this video will give you a clear, honest, and practical understanding of the NCLEX exam. In this video, I'll explain what the NCLEX is, which countries requires or accept it, eligibility requirements, exam patterns and question types, the scoring system, subjects covered, changes introduced in 2026, and finally, how to prepare effectively without unnecessary stress. If you find this video helpful, don't forget to subscribe to the channel. Let's start with the basics. So what is NCLEX? NCLEX stands for the National Council Licensure Examination. It is mandatory licensing exam required to become a registered nurse. The exam is conducted by the National Council of State Boards of Nursing, otherwise called as NCSBN. The NCLEX is used in the USA, Canada, and is also accepted in Australia along with additional regulatory requirements. The main goal of the NCLEX is not to test how much theory you can memorize, but to assess whether you can think like a safe entry-level nurse and make correct clinical decisions in real-world situations. Why does the NCLEX exist? The NCLEX exists to ensure minimum safe nursing competency, protect patient safety, provide a standardized evaluation for nurses from different educational backgrounds, focus on clinical judgment and decision making rather than mere memorization. So what is the eligibility for the NCLEX? To be eligible to write the NCLEX for the USA or Canada, you must complete a recognized nursing degree or diploma, have your educational credentials verified. In most cases, verify your nursing registration from your home country. Once all requirements are met, you will receive an ATT, otherwise authorization to test, which allows you to book your exam. Eligibility requirements may vary slightly by the country and also the provinces, but these are the core steps. NCLEX exam format. The NCLEX is a computer adaptive test or CAT test. This means the difficulty of each question changes based on how you answer the previous one. So the minimum questions are like 85 questions and the maximum can go up to 150. The total testing time can take up to 5 hours, including your breaks. And you are allowed to take 3 optional breaks, that is after approximately 2 hours, 3.5 hours and 4.5 hours. The exam automatically stops once the system determines with statistical confidence that whether your ability level is above or near or below the passing standards. NCLEX question types. The exam includes multiple choice questions, select all that apply questions, that is SATA questions, then case studies, bow-tie questions, drag and drop questions, and sequencing questions. These formats are designed to reflect real clinical decision making and not simple recall. How NCLEX scoring works. This is where many candidates feel confused. The NCLEX does not have a fixed pass mark, and they does not give a percentage score and does not depend on how many questions you get right overall. Instead, it evaluates your ability level, whether you consistently demonstrate safe nursing judgment above the minimum standard. So your result will be simply pass or fail. NCLEX content areas. The exam covers major areas of nursing practice including management of care, health promotion and maintenance, psychosocial integrity, physiological adaptation, and it also includes safety and infection prevention and control, basic care and comfort, pharmacological and parenteral therapies, and a major emphasis is placed on clinical judgment, especially in the Next Generation NCLEX format. That clinical judgment in NCLEX includes recognizing important cues, analyzing the patient information, prioritizing hypothesis, generate solution, take approximate nursing actions, evaluate patient outcomes, and this reflects how nurses actually think and practice in real clinical settings using a personalized, patient centered approach. So, from April 1st, 2026, the NCLEX test plan include terminology and emphasis updates, not major structural changes. One key update is safety and infection control is now called as safety and infection prevention and control, emphasizing prevention over reaction. There is also increased focus on health equity, unbiased patient care, updated clinical language aligned with modern nursing practice. The exam format, number of questions, time limit, CAT structure, and scoring system remain unchanged, so there is no need to panic about the 2026 updates. Now, how to prepare for the NCLEX effectively? First, fully understand the exam format. Choose one main study resource and stick to it. Avoid using too many materials because it causes confusion. Practice NCLEX style questions regularly. Always review rationals, not just answers. Apply priority frameworks such as ABCs, Maslow's hierarchy of needs, patient safety principles, least invasive interventions, stable versus unstable patient prioritization, personalized patient centered care. Remember, NCLEX rewards safe judgment and not memorization. The common mistakes to avoid in NCLEX is memorizing facts without understanding concepts, using too many resources, ignoring rationals, not practicing clinical judgment or priority based questions. So, avoid these mistakes and your preparation will be far more effective. As a final message, you don't need to be perfect to pass the NCLEX, you need to be safe. So, confidence combined with the right strategy leads to success. Thank you for watching Learn Nursing with Anu. If this video helped you, please subscribe, like, and share it with other nurses preparing for NCLEX. I'll see you in the next video. Thank you.